Hello, dear friends and viewers of Energy and Health. Today, we'll talk about hip pain, one of the most common yet often misunderstood types of pain in adults. Many people suffer for years thinking it's arthritis, sciatica, or a vascular issue. But in many cases, the true cause is something called trochanteritis, or lateral thigh pain syndrome. The good news? This condition is completely treatable once you understand what's really going on. What is trochanteritis and why does it hurt? On the side of your hip, there's a bony bump called the greater trochanter. Several short but important muscles attach there, including the gluteus medius, gluteus minimus, piriformis, and quadratus femoris. These muscles do a lot of work. They stabilize your pelvis, rotate your leg, and help you walk and stand upright. When these muscles get overloaded, strained, or inflamed, the attachment site becomes painful. That's trochanteritis, inflammation of the tendons near the greater trochanter. This area is naturally a weak point because it has poor blood supply, so once inflammation starts, it heals slowly. Main symptoms. 1. Pain location. You'll feel aching or burning pain on the outer side of the thigh, about 10 to 15 centimeters below the pelvic bone. The pain often travels down the side of the leg. That's why it's sometimes called Lampas syndrome, like the stripe on a uniform pant. 2. Pain character. It may worsen when walking, climbing stairs, standing up, or sleeping on the affected side. After long sitting or jogging, the pain can become sharp or stabbing. 3. Bell or jump sign. When you press on that bony bump, the pain becomes sharp and shoots slightly downward. This is a classic sign of trochanteritis. 4. No pain in the groin. This helps distinguish it from hip joint arthritis. With arthritis, pain is felt in the front of the hip, in the groin. 5. No numbness or pain below the knee. If your pain goes below the knee or causes tingling, it's likely coming from the lower back, not from the hip muscles. Why trochanteritis happens? The main cause is muscle overload and microtrauma around the hip. Common triggers include repetitive leg movements, walking, climbing, running. Sitting too long, leading to weak glutes. Sudden increase in physical activity. Cold exposure or sitting on cold surfaces. Falls or side impacts. Poor posture or uneven pelvis. High heels or unstable footwear. In women, hormonal changes during menopause also play a role. Tendons lose elasticity and become more prone to inflammation. Even emotional stress can worsen symptoms since muscle tension increases reflexively under stress. How to tell if it's trochanteritis or a spinal problem? 2 simple self-tests can help. 1. Press test. Press on the outer bony area of your thigh. If it hurts sharply, that's trochanteritis. Press on the same spot on the other side. If there's no pain, that's confirmation. 2. Bend test. Lean forward and backward. If pain worsens when bending your lower back, it's likely coming from the spine. If it doesn't change, the issue is in the hip tendons. Treatment and recovery. The great news? Trochanteritis is completely reversible in most cases, without surgery. 1. Shockwave therapy. A modern, highly effective treatment. Acoustic waves stimulate blood flow, reduce inflammation, and speed up healing. Usually 5 sessions once per week are enough for full recovery. Warning: the doctor must target the exact painful spot, not just move the applicator randomly. Accuracy makes all the difference. 2. High-intensity magnetic therapy. Often used alongside shockwave therapy. It improves circulation, relaxes muscles, and accelerates recovery. After 5 to 6 combined sessions, most patients report 80 to 90% pain relief. 3. Local injections, blocks. If the pain persists, your doctor may inject anti-inflammatory medication directly into the inflamed tendon area guided by ultrasound. It's a quick, safe procedure that often gives instant relief. 4. Therapeutic exercise. After the pain subsides, it's vital to strengthen and stretch the hip muscles to prevent recurrence. Do light daily exercises such as clamshell, lying on your side, opening the knees, side leg lifts, hip rotations, swimming, or Pilates. The goal is to restore balance between gluteal and thigh muscles. Prevention and lifestyle tips. To keep trochanteritis from coming back, avoid cold and drafts. Always keep your hips warm. Stretch before and after workouts. Sit upright. Avoid crossing your legs for long periods. Sleep on a firm, supportive mattress. Maintain a healthy body weight. Excess weight adds stress to joints. Women after 45 should check vitamin D and estrogen levels for tendon health. Warm baths, gentle massage, or sauna sessions help relax muscles and boost blood flow. When to see a doctor. See an orthopedic specialist or neurologist if the pain lasts more than 2 weeks, it worsens at night or disturbs sleep, it limits walking or movement, or you develop a limp. Early diagnosis means faster recovery and fewer complications. Conclusion. Friends, trochanteritis is a common but fully treatable condition. Don't ignore hip pain or blame it on age. With proper care and just a few targeted treatments, you can move freely again without pain or fear. Stay active, stay healthy, and listen to your body. If this video was helpful, please like, subscribe to Energy and Health, and share it with someone who may be struggling with hip pain. See you in the next video, and remember, movement is life, and a healthy body begins with awareness.